Kerrin, thank you very much for your time. We've just received the stats, and the stats that I've received say 199 new deaths, but you're saying that actually the NICD, is it, or is it the Health Department infographic that comes out at about this time, is incorrect. And you say it's not 199 deaths, it's 190 deaths, and there are a couple of other errors. So just talk us through the stats that you have, because I'm going to trust you, the doctor, more than what we see on social media.
Sure. And I think that, you know, the most important thing at this point is that stats come through at different times, particularly over weekends. The validations, we're now 18 months down the line of COVID, and so it's you know, much more of a slick machine. But this is a long weekend, and you know, if a couple don't get reported in one cycle and do get reported in the next cycle, it's not a train smash. I think what we're really looking at is that we have 10,000 new cases and 190 deaths. Our recovery rate is still high. Our active cases is still, you know, is on the downward trend. I think the important thing for tonight's and for South Africa to hear is that we are on the downward trend on all of our numbers. So, you know, we watch a number of things to see whether the third wave is starting to wane, and we certainly see cases. The 7-day average of cases, of new cases, is declining. Hospitalizations are declining. Deaths are not yet declining, and they are the last indicator to start declining when we look at waves. But they are flat, which is good news. Of course, the concerning part is that we are still seeing the coastal provinces, KZN, Eastern Cape, Western Cape, and Northern Cape are still not yet on a downward trajectory. So Gauteng has obviously been a significant component of this wave, and it is fortunately on a very nice downward trajectory, but the coastal provinces are not yet. And that, in part, you know, we also have to always understand that our cases are a factor of the numbers that we test. So if we are testing, if there's any interruption to testing, such as the violence that took place and unrest throughout in the middle 2 weeks of July, then that will always have a knock-on effect, in that we may only be detecting cases then a little later than we would have usually. So we always take those kinds of things into account when we're interpreting data.
And of course, the other factors that we look at is the positivity rate. And we know, I think Western Cape has been up near 30%, so in other words, 3 out of every 10 tests are positive, whereas Gauteng has come down to close to 20. Of course, ideally, we want to be 10% and under, am I right?
Yeah. So remember that what the positivity rate reminds us of is it's like a big net that we're casting out to see how many positive fish we catch. And one of the factors of that positivity rate is that people who are symptomatic go for testing. And then, of course, they're able to test. And when we're in the middle of a wave, the capacity of laboratories to be able to handle the number of tests wanes. And so what we really want to make sure from a health system point of view is that those patients or those cases who are really sick need to get tested, so that we get them into care quickly. And so Western Cape certainly put some measures in place as the wave started to increase, that once again limited testing to those who had serious symptoms, those who had comorbidities, and those who are older. So the positivity rate is not only a factor of that there are more positives, but actually a factor of also less test availability for those who have mild disease and those who are younger without comorbidities.
The other factor we look at is the reproduction rate, which we want it to be 1 or below 1. Do you know the national figure at this point?
So the national figure on the Media Hack site, it's usually, so the R0 rate is usually a little bit later than, we see a little bit of a lag on that because it takes a few days to work out. And the last rate that we have is around a week ago, which was very encouraging that it was at 0.96. So, and the trajectory of the R0 over the last little bit has definitely been on a downward trend. So that's looking good.
So that's great news, but here's the thing. I was just going to come in and say, you know, we're getting used to this cycle now, and it seems to be sort of in 3-month waves. What about the fourth wave? I mean, you know, I know we're hardly through the third, but we cannot relax our guard. Wanted to ask you if and when the fourth wave is going to happen, and do you think we'll have enough vaccinations done by then to make a significant difference to deaths?
Yeah. So I mean, I think you've exactly hit the nail on the head, is that we don't necessarily impact on total numbers of infections with, well, we certainly hope we will with vaccinations, but our biggest impact with vaccinations is severe infections and hospitalizations and therefore deaths. And so we're sitting now at around 7-8% of vaccinated population, which is just incredible, and we just can't wait for that to be rapidly increasing into double digits and then, you know, closer up to 50%. So I think what we certainly are expecting is a fourth wave. You know, initially when we'd started, hoped to start the massive vaccination rollout in January, and then we had the blips with AstraZeneca, is that caused us around about a 3-month delay in rollout. And of course, we'd hoped to finish vaccination by the end of this year, and that's not going to happen. So we are likely to still go through a fourth wave. Certainly, if we can get a large chunk of the population vaccinated, we hope that at least the impact of that fourth wave would be significantly lower, certainly on hospital admissions and such, but hopefully also we'll start to see a smaller wave. So if you look at you know, a superimposition of the third wave over the second wave, we pretty much have mirrored the second wave, other than the fact that Gauteng pretty much led this wave versus Western Cape was a lot more had a lot more impact in the second wave. But pretty much for the South African figures, it pretty much mirrors the two.
It's really quite disturbing when you read about what is happening in other countries around the Delta variant. Now, we know that it is more transmissible. It spreads quicker than the original COVID-19 virus. But we carried stories in the last hour that in China they're so concerned that they are literally testing every person over the age of 6 in Wuhan, just to see if they've got the Delta variant. And also news from Mexico that there are far more young people, even proportionally. We know that more people have got infected because it's more transmissible. But they seem to be saying that even given that, there are more people in their 20s and 30s in hospital. And we do seem to be having a lot more younger people in hospital. Is this just about the escalation of a very transmissible variant, or is the jury still out on whether, in fact, it's more deadly?
We haven't seen the evidence that it's more deadly, and I think that I don't think that there's enough evidence yet to make that call. Remember that most countries around the world also focused on their most vulnerable members of the population in terms of vaccination. So we've got a different more factors at play here versus in the second wave, where we didn't have as much population vaccinated in other countries to really see that impact. And certainly even in SA, if we look at the age groups, NICD published that the peak in terms of infections with 572,000 infections are sitting in our 30 to 40 year age group at the moment. And we're certainly seeing around 85,000 in the 1 to 10 year age group, and between 10 and 20 is 210,000, which is more than the 60 to 70 year age group. So we're certainly seeing big numbers. And I think that, initially we weren't seeing children in the Alpha variant, or certainly very few children infected, and particularly, very few symptoms. Second wave, we were seeing more younger people, but certainly now we're seeing particularly even younger. And so it may have part of a factor around some of the protectiveness that vaccines offer the elderly who were vaccinated first, but also just the transmissibility that younger people tend to be the ones who are socializing, and that's where we get it. So remember that in Alpha and Beta variant, we had an R0 for those variants of around 3 to 5. That means that for one person infected, that they could transmit to up to between 3 and 5 people. Of course, that's if they're not taking precautions, such as masking and quarantining and isolating. and we know that Delta variant is between 5 and 8.
Sure.
So, I mean, my own personal example is that having had COVID through our home, our child, one of our children getting ill in the alpha variant stage, none of the rest of the family got ill. And now in the third wave, every single one of us over the holiday, we were in a bio-bubble together, but every single one of us were infected. So, the important part is that you're not to blame if you get COVID, but you certainly can take every precaution that nobody outside of your bio-bubble gets infected. Yeah. And certainly we were able to do that, but every single one of us in our bio-bubble was infected, whereas last time around, not a single other person in the bio-bubble was infected. So it just shows the significant transmissibility. We oversee a number of schools that we care for, and we're certainly seeing just much higher numbers of transmission.
Yeah, you're so right. Thank you so much for chatting to us. You made it such a good point that one person used to infect between 3 and 5. One person with Delta COVID infects between 5 and 8 people. Public health specialist Dr Kerrin Begg from UCT's Faculty of Health Science. Thank you very much for chatting to us. And she's telling us that the latest numbers are 10,008 new infections and 190 deaths in the last reporting cycle. She does give those facts with the caution that we are in a long weekend. Often Monday's figures are a little bit all over the place because things change over the weekend.